Hi everyone, I hope you all are doing great. I am Dr. Tanvi, a physiotherapist at 360 Spinal Wellness and Physio Rehabilitation, and today I'm going to be talking about one of the most common causes of knee pain, which is knee osteoarthritis. Now, as we all know, knee is an important weight-bearing joint of our lower limb. It helps us in all our daily activities like sitting, walking, running, climbing, jumping, etc. And that is why knee pain is a great cause of concern because it hampers all our daily activities. And incidences of knee pain is higher in the older population. So, what can be the reason for this? Before getting into that, let me just explain what knee is, what bones make up the knee joint. So, the knee joint is made up of the lower end of thigh bone, which is femur, the upper end of shin bone, which is the tibia, and the kneecap. So, the surfaces of these bones are lined by cartilage, which helps in smooth movement and functioning of a knee joint. However, over time, this cartilage starts to wear off and starts thinning, but that is because of a natural degeneration process that happens in every individual. However, in some cases, this cartilage wears off to a greater extent and at a faster rate, which leads to roughening of the bony surfaces, formation of bony spurs along the margins, and reduction in the joint spaces. This is essentially what osteoarthritis is. Knee is most commonly affected joint, followed by the hip. Sometimes small joints of the feet are also involved, and sometimes hand joints can also be involved. Usually, there is no one particular reason which can lead to this, but a combination of predisposing factors can contribute to its worsening. For example, age. As I've already mentioned, the older population is at a greater risk. Then gender. Females are generally more prone towards this than the males. Body weight. Obesity is a leading cause because more the body weight, more is the degeneration that happens, and more are the compressive forces that act on your joint. So that is why degeneration happens at a faster rate. And muscular weakness. The symptoms usually include pain, which aggravates after doing some sort of physical activity like sitting cross legged, squatting, climbing up and down the stairs, etc., and which usually improves after rest. Swelling can be seen around the knee joint, and stiffness is also an important symptom. Usually, stiffness is present more in the morning and it reduces gradually as the day progresses. In the later stages or in the advanced stages, the alignment of your knee can also be changed. If the inner side of the knee is more involved, it can lead to bowing of your knees. And if the outer side or if the outer compartment is more involved, it can lead to knocked knees formation. This change in alignment can also hamper your walking pattern, with waddling gait seen more commonly in these patients. Osteoarthritis is generally diagnosed via radiological findings, that is, X rays, and it is classified into four stages, with grade 1 being, being minimal degeneration seen, and grade 4 having maximum degeneration. So, this is basically what osteoarthritis is, how knee is involved in it. So, now that we know that, what can we do about it? Since this is a degenerative condition, you cannot really reverse it. You cannot really change or increase the joint space that has once been reduced. So, what you can do is address it at the proper time and prevent it from further deterioration or from further progression. Usually in the later stages where the degeneration is maximum, the joint space is greatly reduced, the alignment of your knee is changed, you cannot really walk properly, all your physical activities are greatly impacted. In such conditions, usually people prefer surgeries. Total knee replacement has become a common surgery nowadays, and recovery post surgery is also excellent. But I'm not going to be talking more about surgery. I'm here to talk about more about the conservative management. So, what does conservative management include? The one of the first and foremost, the most important aspect of rehabilitation is muscular strengthening. Muscles form an important structures or supporting structures of a body. They are supposed to carry more loads than your joints, but because of our muscular weakness, because of our muscular tightness, these loads are also transferred to our joints and our bones, which leads to their faster degeneration. So, strengthening of the muscles which surround your knee joint, all your thigh muscles, the quadriceps, the hamstrings, the muscles on the side of your thigh, on the inside of your thigh, the calf muscles or your hip musculature should be strengthened in a correct fashion and according to a correct protocol to reduce the compressive forces across your joints. So that is important. Stretching of the tight muscles. Your hamstrings are tight, your calf muscles are tight, your hip abductors are tight. Those muscles should be stretched so as to maintain a proper alignment of these muscles and proper alignment of our body. Along with that, some home remedies that can be used to reduce pain is applying ice packs. Since our joints are already in a state of inflammation, reducing that inflammation and swelling should also be done. So for that, ice packs provide a great relief. Applying ice packs to about 2 to 3 times a day, around 10 to 15 minutes, can provide a great relief to the joint pain. Along with that, one of the conservative managements that studies have shown to have some effect is application or insertion of insoles in your shoes. So insoles are something that are added inside shoes to modify the compressive loads or to modify the mechanical loads across your joints. So lateral wedge insoles, that means insoles that are thick on the outside and taper over inside, are inserted under your heels in your shoes. However, before using or going for any of the orthotics, it is important to talk to your physiotherapist and to an orthotist to get them custom made according to your condition and which are suitable for you. So that can be done. Talking to your physiotherapist before doing that is of importance. And along with that, nowadays a new type of electrotherapeutic modality with technologically advanced modality is used, which is called as EMRT, electromagnetic regeneration therapy, or CRRT, cell repair and regeneration therapy. It is mostly used and utilized and actually studied across Europe, but is now upcoming here as well. So usually what happens is whenever our body is injured, it emits some electrical signals which stimulate our body to initiate the repair process. But as we grow older, these electrical signals are somewhat disturbed. So EMRT mimics these signals and it stimulates our body, or it initiates our body, or it tells our body to initiate the normal healing process, and growth and repair of tissues is started. So this is proven to have effect in reducing pain and in promoting the repair and healing of these tissues. Usually 9 to 12 sessions are recommended, which are 1 hour long each, after which we can start with our regular strengthening exercises. So this is one promising treatment that is coming up. So the conservative treatment usually consists of all of this: your managing your pain, increasing the strength of your muscles, stretching of the tight muscles, and also balance exercises, because balance can be affected because of the joint involvement. So including that in your rehabilitation protocol is also important. So this is basically what knee osteoarthritis is. I've tried to explain it. I cannot really explain it in detail in a small video like this, but I hope you have gotten some idea and you have become a little bit aware of what it is, of how it can be one of the causes of your knee pain. So if you have any doubts or if you have any questions, please shoot them in the comment section below and we'll get back to you. Or if you want to contact us directly, please call us and we'll be happy to help you. If you are suffering from knee pain, or if any of the people you know are suffering from knee pain, book a consultation with us maybe, and we can get it checked physically here as well. So yeah, I think that's it. I'll sign off for now and I'll see you again soon. Till then, stay happy, stay healthy. Goodbye.